Hello, my name is Rob Webster. I'm the Chief Executive of the NHS Confederation. For those of you who don't know much about the Confederation, we're a membership organisation. The vast majority of NHS organisations are members. So we have commissioners, providers, commissioning support units, academic health science networks, the national bodies and others are all members of the Confederation. And I would say, apart from the Department of Health, we're the only organisation that's really got an interest in the whole of the health and care system. And in doing that, we work closely with the Local Government Association, ADAS, national charities and others. And we've got three jobs that we do. The first is to be a system leader. So we've got to talk about where the system's going and try and drive improvement. Second is to represent the views of our members. So we talk to people like Alistair, the Secretary of State, arm's length bodies nationally, and the unions and in Europe, and we represent the views of members. And we also provide some direct support for members in terms of improvement, organisation development, flu fighting, that sort of thing. So the Confederation's got a really important role to play, I think, at what is an interesting and challenging time for all of us. And much of what Alistair Burt just talked about is very familiar to me, I think. And one of the things I would give you some reassurance about is that we've got a constant refrain at the moment, which is, the National Health Service is facing the toughest times for a generation, and probably the toughest time since it was created. And we've got a chance to make sure that it can survive and thrive and be better. There's a lot of work to do to get there, and a lot of things outside of our control. But we've got a chance, and we might end up with, the NHS as a golden cog in the machine. But there's no point in having a golden cog in a broken machine. And the problem we've got at the moment is that the solutions around social care, prevention, well-being and place are missing. So there's a real risk that people in local places will be failed because we have a golden cog in a broken health and care machine. So I'm standing here as one of your biggest advocates because I think if we're going to meet the needs of people in the 21st century, we need to support social care at a much more significant level and see it as an integral part of the health and care system. Many people often criticise NHS folks saying and care as if it's an afterthought. It's not, it's an integral part of people's lives. So I'm going to talk a little bit about that. First thing to say is, whenever we talk about the current system, we talk about money. And money is a significant issue for all of us at the moment. But 18 months ago, alongside Local Government Association, ADAS, national charities and other bodies, the NHS Confederation said, what's the best evidence about the challenges that face us at the moment? And what we said is that there are 7 things that we have to think about if we're going to deliver care better to meet the needs of people today. And the 7 things are that the needs of people today are different. More people, older people with multiple morbidity and frailty and long-term conditions are our patients. 70% of bed days in hospitals are for older people, and 70% of the money that we spend in healthcare is on people with long-term conditions. Last time I looked, you can't be cured of having a long-term condition, you can't be cured of being old, you can't be cured of being a child. What we're going to have is a long-term relationship with you. So the idea that you are admitted to our services in the NHS and then discharged is redundant. So the needs of people are different. That means we have to design care differently. That takes leadership. That leadership's got to be in the system. It's got to be values-based because there are some tough choices to make. Those leaders have to drive a new culture, one where staff feel engaged in the organisation and patients' views are engaged in the creation of new services. That means the workforce has got to change, more across boundaries, across organisations, more generalists and more specialists. We have to embrace technology, because if the NHS was like the rest of our lives, it would be fundamentally different. And we have to worry about the money. So 7 things. And the key message there is if we had all the money in the world, we'd still change the way we deliver care, because society's changed. The great thing is that on the back of conversations 18 months ago and over the last year and before the election, there's a significant consensus about what do we want to do then. What do we want to do? And things like the 2015 challenge, which we curated with a broad range of stakeholders, which represented charities, citizens, local government, the NHS, clinicians, doctors, nurses, therapists, and the 5-year forward view from NHS England, both effectively say the same thing. If we're going to deliver sustainable health and care services, we have to have an ambition for them where they look different. And at this point, people start to chunter on about stuff like structure and multi-specialty community providers and PACs and this, that and the other. It's not about that. It's not about that at all. What it's about is, what is the vision and ambition for the future of health and care in this country, and what does it look like? And if you ask anybody, essentially it boils down to a few things. So the first thing is, the place where you live defines how long you'll live and how sick you'll be. So every decision by local government and its partners should look at wellness, because the place where you live defines how long you'll live and how sick you'll be. Just get your Director of Public Health report out and have a look. You know, health inequalities persist in places, and it's true. So what we need is to look at place first, and public health, wellness, and where people live as the first driver of health and care for the future. Second thing is, we've got 18 million people with a long-term condition in this country. It's going to be 19 million soon. And what we need to do is support them to look after themselves better. They spend 9,000 hours a year pretty much looking after themselves, and the support that they get to do that is limited. It's certainly not technology-based, it doesn't include evidence, doesn't harness their potential. So we've got to make supported self-care the norm for people with long-term conditions, because that's what they want. In addition, what we've got is 1.9 million people, soon to be 2.9 million people with 3 or more long-term conditions. Many of them will be residing in care homes, many of them will be at home and receiving social care support. We know who they are, we know where they live, we know who's likely to fall into that category in the future. If we join up care around them and their needs, put them in the team, the carer in the team, the voluntary sector in the team, social care in the team, and the NHS in the team, what would it look like? It would be a joined up team which made a fundamental difference to them and kept them well for longer. It will still be the case though that they'll have an exacerbation every now and again, and when they do, they should go to a local hospital which is networked so it's viable and sustainable. But sometimes they won't be able to go to a local hospital because their needs are more acute and they'll have to go further away. Because when they do, their lives will be saved and their outcomes will be better. All those services will be available on some kind of footprint 7 days a week, because you shouldn't die on a Tuesday of something you wouldn't die of on a Sunday. And the creation of that has to be done with providers, with staff, and with the public. So that's what these documents say, and I think everybody could get behind that kind of vision and ambition for the future. The problem we've got today, I think, is that people understand the issues of today, people can see a vision for the future, the bridge between the two is unclear. And everybody's dealing with the crisis of today, which crowds out building the bridge to the future and getting there. If we're going to get there, I think there's some fundamental things which we need to do. We need to just start to think about the world differently. If we start from the organisational perspective, which the NHS has done throughout my 25-year career, we will be lost. We have to start with people's lives. So we have to recognise we're a guest in people's lives, they're not a guest in our organisations. As home care providers, you know this. You know the power balance between the citizen at home and your teams is different from someone who's in hospital. And we should see people as issues, not assets. We should focus on their outcomes. And fundamentally, we should really be tough on ourselves and ask ourselves, are we organising around patients or our professional egos? And that's quite a tough one. And if we're honest with ourselves, sometimes we are organising around our professional egos as chief executives, clinicians, or managers. So what do we need to do? Just quickly, what we're saying as an NHS Confederation is, we've had the debate about what the issues are, we've got a vision for the future, let's stop going on about it now, and let's focus on delivery. If we can all get behind, I mean, the degree of consensus at the moment is greater than I've ever known in my 25-year career around where we need to go to. It's also pretty much substantial when it comes to the kind of things that we need. And we're seeing delivery start to happen. So vanguard sites across the whole of England have cropped up, which include care homes in some of them, which focus on urgent emergency care, or think about how do we deliver care in the way I've described, based on what local organisations want to do, and based on a set of national organisations who are saying, we will bend the rules to help you to do it. That ain't going to be enough. Because if I asked you, I thought it was really interesting, the conversation, the question we just asked, how many of you have been involved in conversations about the Better Care Fund? I could probably ask you how many have been involved about conversations about Vanguard or integration, and you might get a similar show of hands. So unless providers, whether they're home care providers, social care providers, NHS providers, are engaged in these things, we won't get anywhere. But we are starting to see, I think, a significant ambition from the ground up to make the sorts of changes which will deliver the future for us. There are 4 things we need to happen for that to be a reality. And we've got 4 obsessions as an NHS Confederation. So the first is, I know what the Minister was saying when he talked about, well, let's hold commissioners to account then for delivery. But top-down performance management of the future will not deliver what we need. We need a fundamental shift away from Whitehall-driven incentives and initiatives to change care to ones that are based on the place. So what we're saying is local leaders need to be supported to work together in a place to deliver care fundamentally differently. That needs to be supported by a national framework of incentives, support, intelligence and infrastructure. So we can see that in places like Manchester through devolution, but you can also see it in South Yorkshire without devolution, or West Yorkshire without devolution, or Hampshire without devolution, where people are working together to do the right thing for people despite the rules. So the first thing we want to happen is that the national framework within which we all operate needs to change so that local leaders can deliver better care for their patients and for their citizens. The second thing we're obsessed about is the money, because we need the right financial context. If we don't have the right financial context for health and social care, we'll end up with a broken set of cogs in a broken machine, or a good cog in a broken machine. But what we won't do is deliver great care for patients. And we've worked very closely with the healthcare associations around care homes and social care to be very clear on this point with the Treasury. Because what we're saying as an NHS Confederation is you've got to fund the system appropriately. And if you're saying, George Osborne, that you're backing the 5-year forward view, the Stevens plan, what it says very clearly in there is you need a major upgrade in prevention and you need to back social care. So our submissions to the Treasury around the spending review all say the amount of money that you put in is a political choice. If you don't put the right money in, there are consequences, and we'll point out the consequences. But significantly, you need to back social care, because it's the right thing to do for patients and citizens. It's the right thing to back the vision for the future. And if you don't do it, you can say goodbye to having an NHS which fulfills its potential. The third obsession we've got is the workforce. We need a workforce fit for the future. This is a seriously contentious issue at the moment in health circles. I know that you're worried about it in terms of the ability to retain, recruit staff in an environment of the living wage and intense pressure on provision. It's quite clear to me that one of the things that we often miss is that the health and care system isn't made of the buildings we work in. It's not made of drugs, it's not made of kits, it's made of people. The people that we employ, the people who serve and work with patients and citizens, they are the health and care system. It's what we spend our money on. It's what drives the delivery and the benefit of everything that we do. If we don't think seriously about the workforce being sustainable for the future, we won't have a health and care system. So we need more team-based approaches across health and care, using the right skills, and we need to make sure that the fourth obsession that we've got is also delivered, that we've got to stop wasting the assets of millions of people every year. So the skills and assets of individuals who we support needs to be harnessed as part of the future. So we all know that you may be somebody who is at home and isolated, but you still have skills. You still have assets that you could bring to others. And we see this through peer support and learning. We see this through co-production of health and care services for the future. And we're wasting the assets of millions of people every year. And we need to bring them into the model of care delivery for the future. Now, the final thing I'll say is that, echoing what Alistair Burt said, all of this requires leadership. And I think we've been in the health and care system as guilty as everybody else of thinking that there's going to be some kind of superhero who's going to come along and save us all. And my view is that that model's dead. The superhero model of leadership is dead. Something's just too heavy for Superman to pick up. What we need is to recognise that we need system leadership. CQC said this just last week. Leadership in systems that's values-based, because you're going to have to make some tough decisions and you're going to have to do the right thing. And leadership that operates at all levels. You're not a leader because of your position, you're a leader because people follow you. And people in this room will be leaders, people you employ will be leaders when people follow them. And if we're going to take people from one place to another in the toughest time we've ever had in the health and care system, then we need leadership at all levels that's values-based and in the system. And on this point, when I first got this job, I had to talk to 1,000 NHS leaders about leadership. And I thought what I'd do is ask somebody who was an expert on leadership to say, what should I say to them? And I could have asked a university, I could have asked the Leadership Academy, but I asked a patient. And I said, would you give me something about leadership? And this patient gave me a poem about leadership, which has subsequently been used by the Leadership Academy, by NHS Trusts and others as a description of what good leadership is. And what he said is, this rhyme is a puzzle, as you will see. This rhyme tells you what a good leader should be. A good leader respects the young and the old. A good leader observes and is prepared to be bold. A good leader is brave and will try something new. A good leader works hard and gives praise when it's due. A good leader expects the best from all staff. A good leader brings happiness and shares in a laugh. A good leader supports patients and gives them the best. A good leader teaches staff to be ahead of the rest. A good leader explains if something goes amiss. A good leader rejoices in times of great bliss. If you study this rhyme and look very close, you'll discover the leader I admire the most. Now, I thought that was really, really clever, because when you read it, you think, right, he's talking about me. I need to think about what kind of leader I'm going to be in the future. What's even better is, this was written by a 15-year-old who communicates by blinking, who spent half his life in hospital, who is the epitome for me of the idea that everyone's got assets if you just think about how you communicate with people. The other thing about this is somebody pointed out to me later after I'd tweeted it that if you look at the first line of the poem, it spells my name. So it was a direct challenge to me as a leader. And the thing I'd leave you with is, if we're going to move from where we are now to where we are in the future, alongside all the things that we need from the national system, we need great leadership. Thank you very much.
I'll take them both together again. Thanks, Mike.
Yeah, you talked about the problems of bridging, to this future that we'd all like to see, but most of us in this room are rather concerned with the crisis at the moment.
Yeah.
Earlier this year, some of the larger national homecare providers were invited to come into the Department of Health to talk about the most precious crisis, and we, for a moment, thought that this was the beginning of something special with integration of health and social care, and we were expecting a series of meetings during the summer to make sure that the same thing didn't happen again this winter, and after 2 meetings, nothing else happened. So my question in short is this winter going to be different to last winter in terms of the crisis in our hospitals?
Okay.
You talked about leadership, vision, issues and delivery. We notice on a daily basis the delayed discharges taking place at hospitals. And this morning there's a report that Lord Carter is recommending building care homes. That seems back to the future really, rather than actually home care being the solution. As providers of home care, we think We are the solution. It is there, and it's just a question of the government exercising its leadership.
So I'll take the second point first, and then come back to, is this winter going to be the same as last one? I think you've always got to look at what the issue is in the system that's causing the symptoms that you see. We're very clear that A&E performance is a function of what's going on in the broader system. So what's the health of the population like? How are social care services being supported? What's happening in terms of community services and intermediate care? Are they full? And the national reporting around A&E crisis being the hospital issue is fundamentally flawed. You know, it's a system issue, it's a system problem. What I'm really pleased with is you're now getting to the point where the Care Quality Commission is making that point very clearly. And I've not seen the original quote from Patrick Carter, but I would say that rather than get hospitals to duplicate what home care providers and others are doing, let's sort out the system. Let's get upstream, let's invest in the things which A, will make a difference to people's lives because they'll get better outcomes, and B, will make for a more sustainable hospital system. I think the last thing that most hospitals want to do is run care homes. In terms of, is this winter going to be any better than last winter? As a positive person, I would point out that more people were seen within 4 hours in A&E last winter than the year before. That we've got world-class standards in terms of how quickly people are seen in the acute sector. And that most other countries don't follow our lead when it comes to the stringency of what we do. Having said those things, unless we embrace a system view about what's going on in your sector, about what's going on in community, about what's going on in primary care, then we'll continue to see significant pressure in hospitals, which is reported as being catastrophic in the media when it isn't, and what we'll be doing is letting people down. So I would say that the more that we can do to make sure that you're part of the conversations around system resilience through system resilience groups, that we're having great conversations locally about whether people are fragile or vulnerable and what support they need, and where we have mature conversations between commissioners and providers about where people might need a bit more support so that patients, citizens and the whole system benefits. And I think there are places where they're mature enough to have that conversation to say, let's sort the issue out and worry about the money after, in terms of who's paying for what and how the money cycles round. I can help, I think, if you want to have a further conversation, to make sure that the right national conversations are happening around the sector. So let's have a conversation about that after.